Richard Branson's Virgin Care won a record £1 billion of NHS contracts last year, as £3.1 billion of health services were privatised despite a government pledge to reduce the proportion of care provided by private companies. Overall, private firms scooped 267, almost 70% of the 386 clinical contracts that were put out to tender in England during 2016-17, according to a new report. They included the 7 highest value contracts, worth £2.43 billion between them, and 13 of the 20 most lucrative tenders. The £3.1 billion in contracts, a big rise on the previous year's £2.4 billion, prompted concern that profit-driven companies are increasingly involved in delivering care, in a development that undermines repeated assurances by the Health Secretary, Jeremy Hunt, that they play only a marginal role. These figures clearly show that privatisation has a strong momentum within the NHS, said Paul Evans, the director of the NHS Support Federation, a campaign group which monitors the privatisation of NHS services and which produced the report. The doors to private sector involvement in the NHS remain open despite promises to move away from market-based approaches by NHS leaders and politicians. Privateers continue to win huge new NHS contracts. Virgin's £1 billion haul means it now has over 400 separate NHS contracts. Its growing role has prompted particular anger among anti-privatisation groups. It pays no tax in the UK, and its ultimate parent company, Virgin Group Holdings Limited, is based in the British Virgin Islands, a tax haven. In addition, it came under fire for suing 6 clinical commissioning groups, CCGs, in Surrey, NHS England and Surrey County Council last year, after losing an £82 million contract for children's services to a rival bid involving a local NHS trust and 2 social enterprises. A settlement of the action appears to have involved the 6 CCGs paying Virgin an undisclosed sum. Virgin said it had been so concerned over serious flaws in the procurement process that it had no choice but to launch the proceedings. The private sector's £3.1 billion of wins last year represented more than 2/5, 43% of the £7.2 billion of contracts tendered by the NHS for services including babies' health and out-of-hours GP care. That dwarfed the £2.55 billion, 35% of tenders won by NHS trusts, and £1.53 billion, 21% by not-for-profit organisations, including charities. Expanding role of for-profit firms comes despite a pledge by the NHS England Chief Executive, Simon Stevens, backed by Hunt, to abolish the purchaser-provider split in the health service introduced by Margaret Thatcher's government in 1990, which helped facilitate competition in healthcare and the outsourcing of services, and promote greater integration of health and social care services. Private health providers now have a strong foothold, said Evans. Billions of pounds worth of opportunities to bid for NHS business are still being advertised, despite numerous failures and widespread criticism. Critics say that the sector's continued success stands in sharp contrast to a long history of winning contracts, often by undercutting rival bids from NHS trusts, only to then hand back those that do not yield a profit to have them taken away because they have provided inadequate care. The report details a catalogue of failures, dozens of examples of private firms taking over NHS services since 2012 but then abandoning them, either because they cost them too much to provide, or could not recruit enough staff, or went into administration, or often because of serious complaints about the quality of the service. For example, in 2014 Circle pulled out of its 10-year contract to run Hinchingbrook Hospital in Cambridgeshire, the first NHS hospital to be run by a private firm, 2 years early, after encountering financial problems and heavy criticism from the Care Quality Commission (CQC), which regulates NHS care standards. In 2013, Serco ended its contract to provide out-of-hours GP care in Cornwall after staff falsified data about its performance. And in 2015, co-performer's £63.5 million takeover of non-urgent patient transport to hospitals.